Developmental prehension components of independent feeding, from assessment to treatment to function. An occupational therapy home program derived from the Earhart Developmental Prehension Assessment, EDPA. This tape illustrates how the EDPA is used to determine missing components of hand skills needed for functional activities such as independent feeding, the relationship of fine motor to gross motor, oral motor, visual and cognitive development, and ways to integrate treatment into a home program. The normal child begins to finger feed at 7 to 8 months and to use both spoon and cup independently at approximately 12 months. Christy, a 6-year-old child with developmental hand dysfunction, is now just learning to feed herself with a spoon. According to the summary page of the EDPA, her fine motor skills range from the birth to 10-month level, left hand better than the right. Most voluntary patterns cluster at the 3 to 4-month level. By achieving the following key developmental components, Christy has been able to begin independent spoon feeding. The components include: first, gross motor components, head and trunk control. Next, fine motor components, accurate approach or reaching toward food, utensil. Sustained grasp of food or utensil. Manipulation of hand to mouth, hand bringing food or utensil to mouth. Release food into mouth or spoon back on plate or cup on table. Next, cognitive and visual components, scheme actions, retention of grasp, mouthing and visual inspection. Spatial relations, visually directed reaching. Object permanence, returning glance to spoon. Means end, shaping hand in anticipation of securing object. Causality, manually performing action of bringing spoon to mouth instead of using eyes or vocalizing to get another person to cause the action. Last, oral motor components, integration of phasic biting and improved lip closure on spoon, cup, or straw. Although Christy has not acquired all skills necessary for independent feeding, she has integrated some basic motor, visual, and cognitive components, enabling her to take her first steps. Ongoing observation and reevaluation will be needed to determine changing intervention priorities in all developmental areas as Christy progresses in her independent feeding skills.
I need to help with the scooping. And take it from there. Oops. Okay.
Oh.
Here, now look at those lips. Look at those lips. Wasn't that good?
Mm-hmm.
Good lips. Should we scoop it down and see? Let me see what she does. Pretty good accommodation, isn't it? She got it in.
She's not doing so much fighting either, is it?
No. Well, she stabilized on the spoon, you realize, with her teeth, which is what normal infants do when they first start. Anyway, they need a place to work from. And her lips are still active. She's doing the scooping. For heaven's sakes, I haven't seen that before.